Okay, welcome to the Deuk Spine Institute live stream of our spine surgery for the afternoon. This patient travels to us from South Carolina. She's a nurse. She has back pain and right leg pain. She has 2 herniated discs with annular tears and very bad discogenic back pain. She also has facet joint pain. We picked up on that on exam. So we'll be doing a Deuk laser disc repair, right L4-5, L5-S1, and a Deuk plasma rhizotomy. Shot. The first thing I have to do is get into the herniation, and the way we do that is transforaminal. We pass through the foramen. That's what I'm doing. You comfy? All right. We found the first bad disc. You're doing great. I'm going to give you some more numbing medicine. Lay still, okay?
Little shot here.
So our patient's awake because I need her help. I need her to tell me, am I getting too close to the nerve root? Now, I could pretty much know where the nerve root is, but sometimes people have some weird anatomy and the nerve root may not be exactly where it's supposed to be. After all, the nerve root doesn't have to do what I want it to do. It was there before me. So I've just got to make sure that the patient doesn't have a really unusual nerve root location, which can happen. I've seen it. So I am going to keep her awake to help me while I access the disc herniations, which are, by the way, just in front of the nerve roots. So I have to go past the nerve roots to get to the herniated disc. She's doing wonderfully. Shot. Now I'm bumping up against her facet at L4-5. And that is one of her painful facets. She's not liking me right now. Right? That's a big facet. Shot. It's hypertrophied, meaning it's bigger than it should be. Shot, but I'm getting around it. AP. Now the surgery you're watching is endoscopic spine surgery. It's the newest, most advanced type of surgery in the world. The way we do it at Deuk Spine, we use a laser. Perfect. The laser helps us clean and debride the herniation and the tear. A herniation happens when, if you look at the back of a disc, you guys see this, Henry?
Yes, we do.
You have the nucleus pulposus and the annulus fibrosus. The annulus holds the nuclear jelly in. You get a tear, and then the herniation comes out. Why don't you show the video of how a herniated disc causes so much pain? In the meantime, we'll get ready for our discogram. All right, now you understand from the video just how a tear forms in the wall of the disc, in the back wall, and the nuclear material that's been damaged during trauma from the tear, same thing that causes the tear, that nucleus pieces start pushing through the tear and make a herniation. All right? By the way, we got a shout out to Michelle and Ashley, who are her friends, I suppose, or family members, and they're watching right now. Michelle and Ashley, welcome. I drew some balloons, so kind of like a little party, but I'm worried they look like something else. But I promise you they're balloons. All right, I tried to put some glitter and stuff too, but I'm not a very good artist. Okay, is she ready?
How are you doing? You ready? Okay, we're going to ask you some questions now.
We did our shout out to your friends who are watching. All right. I'm sure you guys recognize that tattoo. That's the Thunderbirds. I'm just kidding. You comfy? How bad is that on a scale of 1 to 10? What number? Give me a number. How high does it go? 9. Is that where you get back pain?
Yes.
That's your first disc, the L4-5, 9 out of 10 concordant. All right, we're going to fix that for you. That's the good news. I'll be gone when you wake up. How bad is that on a scale of 1 to 10? 10. Is that where you get pain? That's going to be gone when you wake up. Yay! All right. Great news. So Michelle and Ashley, we found her pain. It's at L4-5, L5-S1. It was severe. When I did the injection, you could see her back arch up. We didn't tell her we were going to inject. She just arched because it hurts. That's a clear indication that the disc is the cause of her back pain. That's great news. When I see that, it makes me happy because I know that that pain that she's been suffering with for all these years is going to be gone permanently. All right, lateral. We're doing 5-1 first. Yes? Shot? Okay, so I placed the guide wire through the needle, and we're going to use the guide wire to navigate. In a moment, you're going to navigate the dilator. See that? Dilator is pretty cool because it doesn't cut the tissues underneath the skin. It spares them by simply spreading them apart. Kind of like a little safety pin goes through your lapel on your shirt. Shot? It doesn't actually, Jordan, you need to show us a little more of the behind and a little less of the in front. Here you go. You know better than that. Shot. That's fine. Shot. All right, we're almost there. Shot. I'm going for L5-S1 first. That's the hardest one to fix. In the lumbar. Shot. All right, wonderful. Hold on. Hold your horses. Shot. Now, she lives in South Carolina. Shot. Take that. Let's take that out. Yep. Very good. Shot. That's perfect. So we've now put the dilator not just from the skin incision through the muscle and soft tissues, but we've gotten into the tear of the disc where the herniation is. And literally I just pushed the herniation back into the disc. And now I'm going to go take those pieces out. Is that it? Ay caramba. What do you think, Luis? Let's pull back the dilator a little bit. I think we're in good position, but I want to verify that on a side x-ray. Shot? Well, yeah, we're good. All right. You can see the tube. Any questions from the audience?
Yes, we have a question from Jerome on Facebook.
All right, Jerome.
They ask, how did you determine her facet pain versus discogenic pain?
That's a great question, Jerome. What I did was, can you see here, Jerome?
Yep, we can see.
When I saw her in clinic, I asked her, where is your pain? And she said, it's in here, in this area. She pointed right there. And I said, okay. do you have any pain here when I push, where your facets are? And she said, yes, right there. How about over here? Nope. So basically, I pushed on her facets, and it was super tender. Jerome. Jerome, the Canadian Jerome. Of course. Yes, I know who you are. Jerome Fryer.
Correct.
All right. It comes with experience, my friend. Experience. They say there's no substitute for experience. But don't be fooled. Old age and experience are not the same thing.
Well, that's what you told me when you hired me.
You, my friend, you are experienced in ways we want you experienced. There's lots of older surgeons that don't know what the hell they're doing. And they are old, but they're not experienced. There's a difference. Experience can help people. All right, here we go. Little granulation tissue in there. Now, she had a laminectomy in the past, this patient did. And here she is having surgery again, unfortunately. Why? Because laminectomies never, ever, ever fix back pain. Ever. Back pain that comes from a herniated disc cannot be fixed with a laminectomy. It will only be made worse with a laminectomy. Don't get a laminectomy if you have back pain. That's the real message. Laminectomies are good for one thing. You know what that is? Making money for the surgeon. That's number two. Laminectomy does something wonderful for a surgeon. It ensures you that your patient will need another surgery. And that second surgery is called a fusion. Now, people are afraid of fusions. They don't want them. But after you do a laminectomy, you go back to that patient, you tell them they need a fusion. They're in so much pain at that point because a laminectomy makes their pain worse. But they'll do anything. They'll do your fusion. Okay? That's how surgeons see laminectomies. That's why we don't do them, because they result in fusions. We don't want to do fusions. Fusions aren't good for patients. Fusions are good for everybody but the patient. They're good for the surgeon. I make 10 times more money doing a fusion than I do a Deuk laser disc repair. They're good for the hospitals. Fusions are the highest paying surgeries, usually a couple $100,000. They're great for the companies that make screws and rods, the fusion stuff. Oh man, they make a killing. So they're good for the hospitals, the surgeons, the implant companies, but they're not good for the patients because they don't work. Patients end up needing more pain management, more therapy, more surgery, more shots, stimulators, paint pumps, more procedures, more microdiscectomies, more laminectomies, and in the end, more fusions. And once you get caught up in that vicious cycle, and my friends, it is a vicious cycle. There's no doubt about it. There's no end unless you find Deuk Spine Institute. We can end the cycle. We have to treat all the pain sources. And once we do, you won't have to keep coming back getting more treatment. Our treatments are permanent. They fix problems. All right. Any questions?
No current questions.
Let's show our audience then how the Deuk laser disc repair works. All right, now you understand what the Deuk laser disc repair does. We actually go in with the laser and clean out the tear, just like I'm doing right now. You see that? That is what I'm doing. That's the tear right there in front of you. That's the thing that hurts the patient, causes back pain. See the pink thing over there? That's the end plate of L5. And we're debriding the annular tear right now as we speak. I got about 2 minutes left on this disc. At the same time that we're doing the annular debridement, treating her back pain, we're also decompressing the nerve roots. Because by removing this junk in here, this inflamed annulus and this scar tissue and herniation, by doing this, we're actually taking the pressure off the nerves. Because it's all this inflammatory tissue that's actually pushing on the nerve. Any questions?
No current questions.
Henry, we're going to get some more testimonials done?
Yes, sir.
Nice.
We'll have one done by tomorrow.
All right, that last one was pretty cool, the Croatian.
Yes, thank you. I appreciate that. So, yeah, we'll have a DPR testimonial tomorrow.
The only thing I would say is when I talk in those testimonials about a metal plate, like, yeah, he was offered a metal plate, show a picture of one.
Yeah, I was going to say, I'm like,
That way people can see it, you know what I mean? They can visualize what it looks like.
I was kind of, as I was editing that, I was like kind of seeing, I'm like, should I add one? Should I was just.
Yeah, do one next time.
Do next time? Okay.
Yeah. That way the audience can see the difference.
Yeah, no problem. I think would I have to, kind of have like a warning sign coming up to before we show something like that? That's.
Yeah, I mean, you could do any kind of metal plate, like an animation metal plate. Or
True. Okay.
Or a real metal plate, whatever you want.
I didn't take an animation into account. Okay, no worries. You got it.
All right, just about done. You can see some of the herniation there, the blue stuff. I had a feeling there was a little pocket of it, and I was right. I want to get rid of as much of this as I can safely. Remember, this disc will actually go on the heel itself. As long as we get enough of this blue stuff out, the herniation. done. The nerve will be right up there. You guys see the nerve right there? Buried in the fat, that white thing?
Yes, we do.
So you see how we're just below it? That's the secret of this surgery. To get in just below. Now remember, we're not going to get rid of 100% of the herniation. It's impossible. Nobody can. Only God can. We can do what the best a human can do, which is about 80%. I don't think I've ever gotten maybe more than 80%. But I shoot for 100%. I just need over 50%. As long as you get about 50% of the herniation and debridement of the annular tear, then your patient will have great success. In the immortal words of Borat, great success. Wah wah wee wah. Wah wah wee wah. No, he says, wah wah wee wah. One down, one more to go, and then we got a DPR. Any questions?
No recurring questions, but we do have a comment from Sherry on Facebook.
All right.
They said, "Sounds like you were fighting a nasty cold. Hope you start feeling better, Dr. Deuk."
Thank you very much. You know, I mentioned it earlier. I'll mention it again. My wife always says I share too much information, but I had my sinuses operated on Friday, just like 4 days ago. It was my 4th surgery. Yeah, hard to believe, right? From a guy who always talks about getting it right the first time. Well, I didn't operate on myself, unfortunately. I had somebody else do it. I wish they did it all right the first time. But the reality is most doctors these days, they don't. They do a little bit, and then they do a little more, and then a little more, and they just want to bring you back. And I'm sure my surgeon doesn't do it to milk me, but, you know, in the end, it sure would be nice to have everything fixed at one time. So I finally had my 4th sinus surgery done, and I still have one more to go, believe it or not. And I'm just recovering. And here's the thing, I feel like garbage, but these people come from all over the country, all over the world, for me to do their surgery. And I can't just back out on them because these people rely on me and my team. And it wouldn't be right. I wouldn't want someone to do that to me. So I thought I'd be feeling a lot better. But the reality is I'm struggling a little bit, but it's okay. I don't mind suffering here because being able to give these people the quality of life back is everything. You know, get them out of pain. They've traveled far. They've put their lives on hold. They've come here and stayed in a hotel and gone through all the stuff they had to do. And I know that if it was me, I wouldn't want to be put off by my surgeon. I would be disappointed. I don't want to disappoint them. I want them to be happy. So I suffer a little bit so they can be healthy and happy. And that's the way it should be. My team's the same way. They do the same thing. Not a member of my team wouldn't sacrifice themselves for the patient's well-being. All right, I can't tell. Let's pull that back a little. Shot. A little bit, because I don't know how far in I am. Shot. Shot. What's going on, guys? Cold welded. Shot. Shot. Let's go a little more. Huh? I don't think we're in there. Shot?
Yeah.
Where?
I think it's
No. Keep going a little bit more. Shot. Try to get it. No, we're barely in, right? I think we need to go a little bit further. That's it right there. Yeah, I agree with Jordan. We need to go in a little further. Shot. Yeah, we need to go in a little further. Let me have this. Move. Take that off. Now that. Now that. That should be good. All right. So I'm just draining from my surgery. I am better today, that's for sure. All right, any questions from the audience?
Yes, we have a question from JJ on YouTube.
All right, JJ on YouTube, thanks for joining our live stream.
They asked, if you have a right and left annular tear on the same disc, do you do a transforaminal approach and reach to the other side, or do you do open to separate holes?
Yeah, great question. So we only go on the side the patient has symptoms. So if they have a right and a left annular tear, I would only go on the side where they have symptoms. The symptoms would be leg symptoms primarily. So let's say they have a left and a right annular tear at L4-5, but they have right leg pain. I would only go on the right side. The left side is not symptomatic. There's no reason to operate on it. Huh? Shot? Looks good. Here, let me do it. Basically, if they have bilateral leg pain, we go on both sides. Yeah, it's cold welded, that's why. Basically, we got a piece of herniation stuck in there. Wait. And that's, hold on, keeping the dilator trapped against the inner wall of the cannula. Man, that's tough. Luis and I are getting a workout in today. That should get it. All right, Jordan, pull your fluoro out. Leave it, unless you've got it. I can do the rest if you want. So see that right there? A bunch of material wedged between the tube and the dilator causes it, we call it cold welding. It's really a tissue welding. Wait a second, where's the, no, that's not right. All right. Here we go. She's doing great, by the way. If you're one of her friends, she is a nurse. We get a lot of nurses here. Nurses know, they're smart. They see all these surgeons doing surgery that doesn't work. Fusions, artificial discs, patients do horrible. They see it. They're the ones taking care of the patients. So we get a lot of nurses coming here because they don't want to be in those shoes of those patients that get suckered into fusions and laminectomies and discectomies. Problem after problem after problem afterwards. So we get a lot of nurses. A lot. We even get doctors. But you want to know the funniest thing? You tell a doctor they have to pay for their surgery, and they disappear. You tell a nurse they have to pay, and they show up and pay. A lot of these doctors are so damn entitled. You know that I had to pay for my surgery on my sinus? My insurance denied it. I couldn't even breathe through my nose. And my insurance said, no, we're denying it's not necessary. I got a CAT scan. I had an endoscopy. It showed that my sinuses were just clogged. Like the mucosa was so thick. I couldn't move any air. I was like going to die. And my insurance, United Healthcare, said it's unnecessary. So they didn't pay. So I had to pay. And that wasn't the first time. That was the third surgery that I paid for. Why do I pay for it? Because it's necessary. Because I know it's good for me. I know it's what I need. I don't care if my insurance doesn't pay. I mean, I care. I want to fight them. They're wrong. They're greedy bastards to not pay. But that's what they do for almost everybody. Insurance companies just want to keep the money that you've given them. They don't want to pay for your medical care. The more they keep, the more they deny, the more they keep. The more they keep, the more profit they make. The more profit they make, the more boats they buy, private jets they buy, the more houses in Hawaii, in Maui, the executives can buy. They're just dirt bags. United Healthcare, the same company that denied my sinus surgery, just posted a $5 billion profit in 1 quarter, 3 months. $5 billion. Not million, folks, billion. That was the profit they made. And they're shameless about their profit. They don't care. If they could tell an AIDS patient that they're not going to pay for their medicine. They could tell a cancer patient they're not going to pay for their cancer treatment. So they can make more profit. That's what they do. It's disgusting. And in the end, we have to fight them legally, because that's all they care about is legal fights. There's no regulatory board of doctors to oversee them. They regulate themselves, folks. Maybe you folks don't know that. There's no government authority that regulates them. Your insurance company pays and pays for what they want, denies what they want, when they want. And they're going to keep doing it as long as they get away with it, until you hold them accountable. I'm going to hold them accountable. But the problem is, to hire a lawyer, you're spending $30,000, $40,000 to what? Get them to pay for a surgery that costs you $12,000, $14,000. You're losing money. And they know it. That's why they deny it, because they know you're not going to come and spend 40 grand on a lawyer to get $10,000 surgery paid for. And we keep letting them get away with this.
We got about 5 minutes?
Yeah, but we still have our DPR. We got 5 minutes left. You guys see the tear right there? Right where the laser's working on? And right here?
Yes, we do.
Piece of herniation. So for those of you who are interested, I really think a large part of my problem solving came from playing video games. Yeah. I was an 80s child. I was born in the 70s. But I was in that 80s game craze, right? All the arcade games. Huh? And I'm not talking about Pac-Man and Street Fighter. Yeah. So it all started with those Ataris and Commodore 64s, that kind of stuff. But then I advanced into like the games like Half-Life, which, by the way, I started playing again. And Half-Life is interesting because if you've never played it, you have to solve problems in the game. They pose you with challenges. These things called level bosses. And even without the level bosses, there are challenges. You've got to solve problems. Not enough ammunition, being attacked by multiple enemies at one time, coming from the left, right, above. I mean, new weapons against you. Point is, you got to pay attention. You got to figure out a way to get past that phase. So there's a lot of problem solving that happens in video games. I think for people and young kids that are developing, it's good that they play video games. They actually showed a correlation between really good surgeons and playing video games. Turns out some of the best surgeons are the best video game players. So Just making you aware of that.
I can attest to all that.
Huh?
I can attest to all that because
Yeah.
as a avid video game player,
Yeah.
I did not know you played Half-Life. That's really awesome.
I've played it over the years. Huh? Yeah. And I just started playing it again lately. I play on my computer. I'm a PC guy. I'm politically correct. I'm not a Nintendo guy. I'm not. Really? Yeah. I'm not an Xbox. I like graphics. I like rich graphics experiences. You know? And I never found those little gaming console graphics to be equal to the PCs. You have to use a lot more imagination with the little consoles. All right, just about done. About another minute here. We're going to move on to our DPR to treat her facet pain. You all right, Bernez? So the last case for the day is a patient who has lumbar disc herniations that are symptomatic. He's got bilateral, 4-5? He's got 4-5-5-1, symptomatic. Love those bilateral 5-1s. Anyway, he's from where? New York. New York. Laser. New Yorkers, wake up. It's from Queens. Queens, New York. Get out of here. That's where my mom's from. My mom's family. Queens. Is it really yours, Bernez? You're just saying that. You're just saying that. All right. My mom grew up in Queens, Ozone Park. Ozone Park. She went to John Adams High School. All right, we got one more little treatment we need to do on the facets. Any questions from our audience?
No current questions.
Let's bring the scope in. And we have two types of scopes. Actually, we have three, but we're not using the third one today. We have a fluoroscope and we have an endoscope. We also have a microscope. Shot. Looks pretty darn good. 4-5. Actually, we're doing 4-5, right? So we don't need 3. Shot. 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 Any questions?
No current questions.
Shot? Yeah, it's perfect. A little higher up on the fluoro. Oh, wow. I can't feel it. There we go. Shot. Shot. All right. So I think I'm feeling our transverse process. I want to be 100% sure. You got to be on bone. Shot. You can see the TP there, right, George? Yeah, it's not well formed. Shot. But I'm right on it. Shot. Yeah. Her TP is not normal. It's very small. You guys see that, how tiny it is?
Yes, we do.
Shot. 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 It's like perfect, right? Well, let's hope that does it for her. Thank you, everybody. Good job. Let me sneak by you guys. If you have questions, folks, type them up. I'll come answer them for you. Thanks, Henry. Good morning, I'm Dr. Deuk. I'm here with a patient who traveled from California to Deuk Spine Institute here in Florida for back pain that he's been suffering with for about 7 years.
Yes.
He's a father and he takes care of his family. It's been really hard for him to do so. He's actually gone for surgery already in the past. I think you had 5 surgeries done?
Yes, I have 5.
And that was done at elsewhere?
Yes.
We won't mention. You can say the name. Go ahead. Tell us your story. We want to hear it.
So I'll say this quickly if I can. So I come from San Jose, California. I had several procedures in the beginning of the year by the Bonatti Spine Institute here in Florida.
With the hope that it would get rid of your back pain.
And it did not.
It did not.
Everything they said they were going to do, they did the opposite. If anything, it left me more physical and I want to say mental pain.
Horrible back pain.
Very. It's an understatement.
And you have a child that relies on you. You have a family that relies on you to be healthy.
Absolutely. I have a 19-year-old autistic child that me and my wife take care of. And I mean, I can go on and hours about that, and it requires my help. If not greater part of the day, I'm also a business owner of a painting company in San Jose, which my employees rely on me. So long story short to all that, a lot of people rely on me. If I cannot even stand or sit up for any time of the day, I feel useless. Stabbing pain in my back, my lower back, my buttocks to my legs, it was just there constantly. I had my surgery done yesterday. Dr. Deuk here took it away. It's gone. I feel a little bit of my surgery stuff, but other than that, I don't even really feel that, to be honest with you. I don't. I'm able to sit up straight. I'm not trying to compensate what side of my body to sit on. I'm actually sitting straight. So.
How does it feel to know that pain you lived with for 7 years, that's hounded you for 7 years in your back? How does it feel to know it's gone now?
It feels fantastic. It feels great. It feels like a little too good to be true, but it's gone. It's literally gone. I have to learn how to feel good again and just take it step by step.
Now, when people get open back surgery, doctors put them on narcotic painkillers, opioids. Are you on any opioids from us?
No,
Nope.
none.
You
None.
took Tylenol maybe last night, and that
I
was
didn't
it?
even take that, and didn't need to take
So
that.
basically, no painkillers.
None, no
Yeah.
painful.
Because this incision is just 7 millimeters. You can see in his surgery, we made a tiny little cut on his back, and we showed his scars from the other surgeries he's had elsewhere that he mentioned. And there's all these scars on his back, and all those scars and all that surgery, what did it do for you at the Bonatti?
It made me not believe in any doctors. It made me scared. It really did. I come from a background that, when you shake someone's hand and you look them in the eye, they say, we're going to take care of you. That's what I do. I'm in a service business. So when I tell somebody not to worry, I got you, I mean that. So when Dr. Deuk said not to worry, we're going to take care of this, I was kind of a little bit okay. I wasn't overly excited because I didn't want to overexcite myself. I wanted to see what happened. But right now I'm literally jumping inside. I'm jumping, yes. So I'm very happy and very thrilled.
I'm so happy that you're doing well and that we've made a big difference in your life and the life of your family. I met your mother.
Yes.
She's very sweet. She's here to help take care of you. Anything you want to tell your family or friends out there that are going to watch your video and your experience here at Deuk Spine?
I would like to say, and if I can say this, I know there's a lot of testimonials, but if you have any problems, if you really do, come here. Come to Deuk Spine Institute. They'll take care of you from the first phone call to setting up the initial timing of having Dr. Deuk look at the imaging and your report. Come over and get it done. Have him take a look at it. He gives you a no BS type attitude, straightforward. And if he's going to help you, he's going to help you. And you're not alone after that as well. I feel very welcomed here. Even though I live in California, I'm not being rushed to go back home. From the staff here, from the front office telling me hello and whatnot, I'm very welcomed here. And I feel that I have a spine doctor for life. If need be, if I need to come back again for anything else.
And I don't think you're going to need to come back. And one thing that I want to emphasize is the other surgeries you had done at the Bonatti. It's not that the Bonatti is a bad place in any way, in my opinion. They just did the old-fashioned laminectomy, microdiscectomy. And the problem is that surgery doesn't address the pathology, what's causing people's back pain. Because the problem that's causing your pain is the disc. And they're coming from the back, removing bones and ligaments in the back of the spine. They're not getting up to clean the tear in the disc. You got to do the annular debridement, folks, if you want to get rid of back pain. And laminectomies and microdiscectomies, they don't do that. So that's why people have such bad experiences with those types of procedures. It's not necessarily the doctor, it's the procedure that's bad. The problem is the doctors are recommending that to patients. There's a far better new technology now, the Deuk laser disc repair. Would you agree?
Absolutely. 1000%, absolutely. Thank you again, Dr. Deuk.
You're welcome.
Thank you, sir.
My
Thank
pleasure.
You. Thank you, sir.
You're welcome.
Thank you.
You're
Thank you.
welcome.
Yes, sir.
That's why we're here.
Thank you.
All right. All right. Well, that was a lovely testimonial from one of our patients. And so we're done. The surgery went well. Again, she has back pain that we confirmed was coming from the L4-5, L5-S1 disc. That was done with the discogram. And we repaired both of the discs with the laser. She also had facet pain, which we treated her facet joint at L4-5. I hope that's the one that's bothering her. It seemed to be the one on her exam. We'll take our questions.
First question comes from George on YouTube.
George?
George asks, have given at university Hippocratic oath, it says you never take money from doctors. That's why doctors don't pay you. You shouldn't ask for money.
George, thank you. I wasn't aware the Hippocratic oath addressed charging doctors for money. I don't agree with you. I think you're wrong. The Hippocratic oath talks about putting patients' needs first and prioritizing patients' needs over yours. That's what the Hippocratic oath is about. But in case you didn't know this, you cannot take care of patients if you don't have money. Money is necessary to buy supplies. Money is necessary to pay the nurses their salaries and the doctors their salaries, to pay the rent. I'm not sure if you understand that, but the comment you made seems childish, at least childish. The reality of medicine is that medicine is expensive to practice, and money doesn't come from anywhere but your patients. We don't have the government paying us to do surgery on patients. We don't have donors donating money so we could do surgery. So all the money we need to run our operation has to come from the patients. And the patients include doctors and nurses. So you have to charge doctors and nurses.
Next question comes from Shannon on YouTube. Shannon says, "Hi, my name is Shannon. I'm from Michigan. I've had 3 herniated discs. I've had spinal injection and a medial branch block. Nothing has helped, and the medial branch block worsened it. I was down for a while after. Is there anything that can be done to help?"
Yeah, Shannon, we can fix your back pain. It's very easy for us to do. It sounds like it's coming from the discs. The discogenic back pain is something most doctors can't fix, so don't expect them to. They'll do shots, they'll give you pain pills, they'll send you to therapy. All of those things will just make it worse. There's only one way to fix disc pain, and that's with surgery on the disc. There's 2 options. One is fusion, which you don't want. The other one is laser surgery, which we just did. It's the best way to fix disc pain. So my advice to you, Shannon, is get your MRI review in. Go to our website, mri.deukspine.com. Fill out the form, answer the questions about your pain, treatments, and then give us your MRI. We'll set up a virtual consultation. In that consultation, I will diagnose what's wrong with you and how to fix it. And we'll give you your options for treatment. Okay? Don't give up hope. We can get rid of your back pain.
Next question comes from Premier Media Group on YouTube. And they ask, "Hey doc, what about scarring from previous open discectomy surgery plus new disc herniation? Can your procedure remove laminectomy subdermis scarring as well as annular tears?"
Yeah, it's a great question. So one of our viewers said, hey, laminectomy was done, there's scar tissue everywhere, and there's another herniation, or the same herniation probably, that was never taken out. Can my procedure, the Deuk laser disc repair, fix this? Absolutely, 100%. The most important thing is make the right diagnosis. Where is the pain coming from? If it is coming from that disc, then the Deuk laser disc repair will fix it. If it's coming from a facet joint, the Deuk plasma rhizotomy will fix it. And just to be clear, what's the difference? Let me show you. This is a disc here, this white thing. And this is a facet joint here. Disc pain, facet joint pain. Totally different structures, require totally different treatments. But we can fix pain from both.
And that is it.
All right. I hope you enjoyed watching and learned something. We'll be back in about 45 minutes with our last surgery for today. This patient is having a bilateral L4-S1 Deuk laser disc repair and a right L4-5. Thank you.